The Health Ministry reiterates the importance of shifting care and preventive interventions to communities and homes while still being anchored by healthcare institutions. Now, this is so that the young can pick up good habits while Singapore faces an ageing population.
Health Minister Ong Ye Kung making that comment at a medical awards ceremony where those focusing on research, clinical and community care have been recognised.
We have therefore generated, I feel, a decisive and I think irreversible momentum to extend healthcare, specifically preventive care, in communities and homes. And this is a challenging stage of evolution of our system. We will need an abundance of resourcefulness, innovation, and boldness to sustain this momentum and generate breakthroughs at the systemic level.
A group from Changi General Hospital has clinched the National Clinical Excellence Team Award. Their program equips nursing home staff to provide geriatric and end-of-life care to their residents. As a result of the program, nursing homes have seen reductions in admissions and the period of hospital stay for their residents. 6 people also recognised across 4 categories, including those in the field of research and education.
And we're joined tonight by 2 recipients of the National Outstanding Clinician Award, Professor William Huang, CEO of the National Cancer Centre Singapore, and Professor Tan Hui Chim, Senior Consultant at the National University Heart Centre Singapore. Well, first, both of you fresh out of the award ceremony, clearly, and congratulations. I'll start with a deceptively simple question. Prof. Huang, you can take that. What motivates you to keep going?
Patience are my strongest motivation. I chose hematology and the subspecialty of stem cell transplantation because I saw that it could give patients a real chance of a long-term cure from otherwise fatal bone marrow diseases and blood cancers. It is a challenging field, but the positive impact that it could have on patients is tremendous. For example, over the last 30 years that I've been a clinician, I've seen the survival for patients with blood cancer being about 2 years in the 1990s to now 5, 10 years, and even beyond. To see my patients receive successful treatment and live long and healthy lives just reminds me of the reason why I chose to become a doctor.
I think medicine is a calling, and it's such a blessing to be of service to patients in need of your expertise. So as an interventional cardiologist, I see the direct impact of my work on patients. And so to be able to see them recovering from their sickness, returning to their family and their job, and preserving their quality of life is my biggest satisfaction.
Prof. Huang, your reputation in this field is stellar, to say the least. So congratulations on winning this award. I'm very happy for you on that. Your work as well, it's known locally, it's known internationally on the study of blood and blood disorders, to put it simply for our viewers. How has your work overseas helped to inform and perhaps drive your work in blood cancer and stem cell transplantation here in Singapore? Give us some context to this.
Well, it's been a real privilege to represent Singapore on the international stage. And when I was president for the World Marrow Donor Association, from 2013 to 2015, I had the opportunity to initiate conversations with my counterparts from across the world on how we could improve the search for a stem cell transplant donor. I'm happy to say that since then, the global search for a donor has become a lot easier and faster. I've also had the opportunity to serve as Asian Vice President for the International Society for Cell and Gene Therapy, and using cells and genes to treat patients has been revolutionary, and it's the new frontier in medicine. With my role in the ICT, I've been able to facilitate collaborations, clinical translations, so that our patients here can have access to these promising treatments.
Professor Tan, in your line of work, so cardiology, you have pushed to make it far more nuanced, so not just cardiac treatment for anyone with a heart, essentially. You have sports cardiology, geriatric cardiology, community cardiology. Is this developing in tandem with what you see in terms of Singapore's aging population, our healthcare needs as we move into, I suppose, a more silvered society?
I think it's you're absolutely correct. The development of subspecializations in cardiology is really driven by the demands because of the heavy cardiovascular disease burden that this country faces. As the population ages, you're going to see more patients having comorbidity, and so it's just naturally obvious that we have to
very quickly. What's comorbidity?
Change. Comorbidities means concurrent illnesses.
Okay.
For example, heart patients may have kidney problem, may have lung problem, and so forth. So it's just obvious that we have to evolve and change and transform our care to cater to this need of the aging population. So you just mentioned sports cardiology. Increasingly, many patients, heart patients, want to undertake exercise, and we have to make sure that they're fit to do so. Cardio-oncology, so patients with heart condition could also have cancer conditions that require treatment. So we need subspecialty. What I see more importantly in the future is that of a geriatric cardiology care because of our aging populations. Most of the cardiologists now are aware of this aspect of care, but many of them
very
actually...
quickly, and I'm sorry to disrupt your
Yes.
next question, but could it become a problem where everyone becomes so focused on their speciality and there's no overrush? It used to be a very good GP can see to anything, but now you've got more and more nuanced, more and more specialized. Who can oversee all the different comorbidities, to quote you? Very quickly, so I don't...
Well, it does not mean that people who subspecializes in certain fields ignore the rest of the other fields. So a cardiologist could be a general cardiologist with a special interest in some of the subspecialty. So we need people who are subspecialized in order to provide the best care possible for the group of patients. So as I said before, the geriatric cardiology is important because of our silver population. And geriatric care is not something that is familiar to most of the doctors or even cardiologists now. Most people actually learn it through self-taught, or they learn it from their own personal experiences. What we need really in future as we move on is to upskill our doctors and cardiologists to learn about the techniques of geriatric assessment, understands what our aging population needs, such as perhaps they have problems of polypharmacy, they perhaps may have different perspectives and goals of treatment options and outcomes compared to the younger population. So increasingly, I think we are moving towards a multidisciplinary care for our aged population.
Let's look at the landscape here, because with all of this promising innovation in medical research and so on, we have to be able to protect it as well. And Prof. Huang, you have patents on some of your developments for treating disease. How can we actually continue that so that we can encourage more of this medical research that is protected for Singapore, for our local sector?
Well, medical research and innovation needs to be driven by the clinician who is seeking to meet their patient's greatest need. Scientists who help find solutions to those problems, government, industry, and investors who curate this and say, hey, I want to support this because it can help Singapore and the rest of the world. And then collaboration among all these players is very important in our small little island nation.
And we might as well end on that note. And this question again for both of you, and this time we'll start with Prof. Tan. You mentioned small island nation. Now, both of you also mentor and teach medical students. And I think, Prof. Tan, it's been specifically pointed out how that is a very important task for you. Do you think Singapore has the talent and numbers to keep up with our increasing healthcare needs? First, Prof. Tan, then Prof. Huang.
The medical profession is quite a well-respected vocation in Singapore, and that's why we attract every year the best students to join the professions. And I think that there will be no lack of talent coming into this field. What is going to be different is that the medicine of the future is going to be quite different from what it is right now. It's evidently going to be shaped by artificial intelligence, bioinformatics, precision medicine, and so forth. So the onus for us now is really to train our younger doctors to acquire these new skill sets, while also maintaining the usual expected skills and traits of compassion and care for our patients, together with being proficient in communicating with our patients. So all these values are core to the medical profession.
Prof. Huang, what about for you?
Well, our medical students and junior doctors are very talented and driven. So I think the future for medicine in Singapore is very bright. The new generation is more thoughtful and questioning. And they often give very new, interesting perspectives and ideas on how to evolve and change and improve our healthcare system. For example, with AI, precision medicine, and also getting rid of unnecessary work so that we don't just work harder, but work smarter.
Thanks so much for joining us this evening. Congratulations again, the two recipients of the National Outstanding Clinician Award, Professor William Huang, CEO of the National Cancer Center Singapore, and Professor Tan Hui Chim, Senior Consultant at the National University Heart Center Singapore. Thanks so much for covering this evening.